We are currently in the midst of probably the most serious addiction epidemic in the history of Ohio. It is claiming hundreds of lives every year, and it's important for young people to have a clear understanding of how this started and where we're at right now. There is a natural progression from prescription opiates to heroin. And by the way, it's important for those people viewing this video to have an understanding, a clear understanding, that the vast majority of people who are currently addicted to heroin started on prescription opiates. The reality is that from an economic standpoint, prescription opiates are about 10 times more expensive than heroin. A milligram of prescription opiates is about $1. So a 5 milligram Vicodin is about $5 on the street. Heroin, on the other hand, is about $10 per dose, and an average dose of heroin is about 100 milligrams, so it is about 10 cents per milligram. So those people who are addicted to heroin start out on prescription opiates, and as they move through their addiction, many of them will transition from prescription opiates to heroin because of the cost factor. So why should young people care about the prescription opiate and heroin epidemic in our state? The reality is that in 2011, the Department of Health recorded 1,765 overdose deaths in our state. And reflecting back on historical trends, if we go back to 1979, there were fewer than 200 people dying from overdoses in Ohio. So what we've seen is this unprecedented increase in overdoses, largely attributable to the use of prescription opiates in our state. And as a result of which is largely a result of the use of prescription opiates in our healthcare system, we should all be concerned about the use of prescription opiates. And there is clear evidence that young adults, those persons between the ages of 18 and 24, may have a degree of susceptibility to prescription opiates that exceeds other age groups in our state.